Hi, it's Dr. Neuhaus again. I have a neat procedure we call shockwave therapy. This is a low energy therapy treatment that we direct towards either Achilles tendonitis or plantar fasciitis. That's really where we use it. It can be used in other parts of the body for different problems. But here you can see we're using it on the back of this patient's heel. We apply the probe with some ultrasound gel right over the insertion of the Achilles tendon, which is the point where they're having their maximum amount of pain. What this does is it's connected to a little machine which we can control the force or the amount of activity with it. But essentially it's sending little pulses of energy into the skin at a certain depth. And what this does is it stimulates the body to have an inflammatory response. So the body will react to the new trauma. We're taking a chronic soft tissue problem and trying to make it more of an acute problem, meaning this pain that you've had for a long period of time, we're trying to wake the body up so that it will start healing the pain. Whereas in the past, the body's kind of recognized it as, okay, I've got this pain and I'm going to reset my baseline that this is normal, this is what I have to live with. When in reality, we need your body's immune system to kick in and start getting rid of the inflammatory process that's going on in the back of the heel. Or wherever it might be. So this procedure, we take, put the probe on there. It takes about 5 or 10 minutes to do. We will direct it in different areas based on the type of problem. And I'll say, we come from different angles. But the idea is to cover the area of inflammation with the shock waves. This is a procedure for the Achilles tendon and for the plantar fascia that we do once a week. You are not able to take anti-inflammatory medicine, meaning ibuprofen or naproxen or Aleve or whatever it is you have at home, because we want your body to become inflamed and recognize this as a new problem that your body, your immune system will then go in and heal it up. So you can't do that. You can do any other activities though. You can be in normal shoes, normal sports, whatever you can tolerate with the pain that you're having. And typically each treatment builds on the previous one, meaning you might be a little bit better after the first one. If somebody's 10 to 20% better after the first week, that's pretty average, pretty good. And then after the third treatment, I expect someone to be maybe 50, 60, 70% better. After the fourth one, you give it another 3 or 4 weeks, and that's when the pain should be completely relieved. So you can see from looking at the video, it's not a real exciting procedure. We just hold that probe on there and let it do its thing, directing the treatment at that point of maximum tenderness. But typically people tolerate it very well, and we have good success with it. So I hope that helps you understand a little more about shockwave therapy.